It's notes from No More Hygiene, Dr. Nabors. Good afternoon.
Hello, Steve.
And late breaking news again. There is all kinds of stuff being released. It seems like every day on the true nature of periodontal disease, its whole health consequences, and you've got some pretty interesting information that adds to the body of all the things that we've been talking about that has to do with brain health. So tell us about it.
Right, and that's one of the hottest topics right now as it pertains to oral systemic health, is the connection between Porphyromonas gingivalis and Alzheimer's disease. And we talked a few episodes back about the connection of PG and the GAIN trial, where a company called Cortizyme was developing a medication specifically targeting PG. And that medication is called a Tugastat. And I actually think I pronounced it right for the first time ever. Right.
I want to know who named that one. That was not easy.
But the publication appeared in Medscape, which we're all familiar with when we Google health ailments. Medscape is a very popular internet tool for researching medical ailments. This was presented on November the 23rd and uses so much of the same terminology that we use in No More Hygiene, which is low-grade chronic infection, inflammatory markers, how Porphyromonas gingivalis can invade cells. So it can invade cerebrospinal fluid. And they talk a lot about genetic risk factors. And they noted that 22 of the 25 genetic risk factors identified in acute dementia relate to immune system function. And so that's just talking about the destructive nature. When we talk about how do neurons get destroyed by amyloid, in the same principle as how does bone get destroyed in periodontal disease, it's the body's immune response to a bacterial pathogen in the wrong place at the wrong time. And then a chronic low-grade body response creating destruction, and it just parallels that very well. And we'll send the link to everyone after this, after we get done talking about it.
So I think one of the interesting things about this is that it appears that the medication that's going to come out to deal with Alzheimer's, that one of its first functions is to get rid of PG.
Absolutely. And so the way that medicine and medication works, especially in our colleagues in our MDs, would be that they're going to find the target pathogen and then create medication to eradicate it, much like a Z-Pak for a sinus infection or amoxicillin, let's say, for strep throat. And so this type of medication is actually targeting Porphyromonas gingivalis. So it'll be an oral medication taken for periodontal disease, even though it's actually going to be for Alzheimer's.
And its ongoing use is going to be to keep PG at bay.
At bay, right. And one of the interesting things about this, and I'll kind of read that, is that the drug cannot, once the Porphyromonas gingivalis enters the brain and gets in the cerebrospinal fluid, the medication cannot completely eradicate it. It's about 80 to 90% effective at controlling it. But they're looking at this more as a long-term care. They equate it to medications that are currently used to treat HIV, meaning that we're trying to keep this problem at bay. Once it's there, we can't eliminate it, but we can certainly knock it back to the point where it's not going to progress. And so you're talking about a long-term medical support or medication support or something like this. But, I found one thing that I'll just kind of read it, is commenting on the research for Medscape Medical News. Rebecca Edelmeyer, she's a PhD. She's a senior director of scientific engagement at the Alzheimer's Association. And she said it's really encouraging to see approaches like this that look at this disease from different angles. And she said, we learn something new from every trial. And so you've got people that are willing to take this medical mystery that we've talked about, which is Alzheimer's and dementia, and be willing to look at it differently and look at other possibilities. And I think it's a real parallel to how we in the dental profession need to be looking at periodontal disease. We cannot be looking at it the same way that we've always looked at it, from scaling and root planing in 1 quadrant per hour, and thinking that using hand instrument scalers and removing debris is somehow going to stop PG from getting into the cerebral spinal fluid and into the brain. I mean, we have to look at this as a medical problem. A medical disease of the mouth that physicians can't treat is a popular thing that we talk to with our patients.
Great insight, great update. We'll include the link to the referenced research with this video. The research keeps compounding. I find it fascinating now. I mean, we've narrowed this down, been narrowed down to one bacteria that is the bad guy that's causing the problem, and more to come, obviously, but one more piece of the puzzle to share with your patients that underlies the whole importance of, man, treating it, curing it, and save lives, change the course of somebody's life. Absolutely. Thank you, Dr. Nabors, for sharing. Thanks for keeping our brains healthy. I'm gonna go get my teeth cleaned.
Yeah, go do that.
Thanks, man.